Hi, I'm an HIV cell, and I'm here to talk to you about HIV and AIDS. So, the top 3 things that you would want to know about HIV and AIDS is that, firstly, HIV is important to test for all the time because the sooner that you respond to it and receive treatment means the longer you have to live, because HIV is an infection that weakens the immune system over time. It's critical that you get tested early on so that you have more time to receive treatment and thus live longer, because treatment does exist, but the sooner you hold out on getting yourself tested and figuring out whether or not you really have the illness, the longer it will take to treat the infection and the less time you may have to live. I think it's important to note that those who should be getting tested are men who have sex with other men, people with more than one sexual partner, transgender people who have sex with men, people who have recently had an STI, and people who use injection drugs. These are the most common ways to contract HIV. If you were wondering why I'm an HIV virus wearing these sunglasses and big nose, it's because I'm trying to symbolize the fact that HIV symptoms might not be very apparent to people. They might just look like flu symptoms, but if the flu persists past 2 to 4 weeks, then it's safer to say that you should go get yourself tested just in case you may have HIV. The second most important thing to know about HIV is that it can only be transmitted through blood, semen, anal fluids, and breast milk. It cannot be transmitted through saliva. And I think this is important to know because a lot of people assume that a person with HIV shouldn't be touched because or kissed because they're feared that HIV will be transmitted to themselves in that way, and that's just not the case. We really need to stop ostracizing people with HIV, and I think the way to do that is through education, so that people understand that just by touching someone with HIV doesn't mean you're going to contract the virus. It's actually a fact that people with HIV are undetectable. Like if you were in a room full of people and one person or 2 people had HIV, you probably wouldn't be able to tell them apart from anyone else in the room. So if you know someone has HIV, it's important to ensure that you're not ostracizing them or judging them because of that illness. So the third piece of information to know about HIV and AIDS is that AIDS is the final stage of HIV. I think it's important to differentiate between the two because a lot of times people will substitute AIDS for HIV or HIV for AIDS and not really understand the difference between them, myself included. So AIDS is the final stage of HIV, and this is when the infection is so advanced that the immune system is severely weakened, and this can be diagnosed through the observation of certain symptoms in patients who already have been diagnosed with HIV. So in summary, number 1, first and foremost, you should get tested for HIV to ensure that you are still healthy and that your immune system is still intact. Secondly, you should note that HIV is only transmitted through blood, semen, anal fluids, and breast milk. You cannot contract AIDS just by touching a patient with AIDS. And finally, AIDS is the final stage of HIV. They are 2 separate things. AIDS is HIV. HIV is not AIDS.